Hello everyone, I'm Dr. Ghanee. Thank you for joining me and watching the video. Today I'm going to talk about vascular lesions that can occur in the oral cavity. Look at this lesion on top of the tongue. It has deep purple color and it is obvious that's growing under the surface mucosa. What are the possibilities here? We have a long list of differentials, but I'm going to talk about the common ones. Number one is a hemangioma. Hemangioma means numerous blood vessels, they grow and they make this tumor, and it is benign. Another possibility is lymphangioma. Lymphangioma is composed of lymphatic channels and blood vessels, and it is benign. Arteriovenous malformation, also benign, is on the differential list, which means bunch of arteries and veins, they are being formed in an unusual way, arteriovenous malformation. Cysts in the oral cavity can look like this as well. Sometimes these deep purple lesions are on the inner lip, and dermatologists, they call them venous lake. Basically is a dilated vein. So these are all vascular lesions and they are benign. How we manage these lesions? If I see in the chart other dentists and hygienists, they have noticed it in the past, they have measured it, they have put a picture there in the chart, I am sure this is benign and it has been sitting there for a long time. So I call it monitor and I keep monitoring it for the patient. If patient remembers has had it for a long time and has no symptoms, we monitor it. But if it's new and patient is concerned and there are symptoms, we always remove a piece as incisional biopsy and we put it under the microscope, or sometimes when it's not large like this one, we completely remove it and we put it under the microscope. I see these lesions on top of the tongue, side of the tongue, inner cheek, and on lip mucosa inside and on the lips, upper or lower lips. Let me show you some examples. This one is the same lesion and it's happening on the side of the tongue. This one, upon palpation, was more fluctuant. Those are usually lymphangiomas. And you see another case on top of the tongue, very prominent. And this one is on inner cheek. A lot of them that they occur on the inner cheek, patients remember that it came after trauma. And this one is on the lower lip. This guy was worried and wanted me to remove this, and I removed it, and the result was hemangioma after it went under the microscope. And this one, this lady wanted me to remove it. She was worried and concerned, and the pathology result came back as arteriovenous malformation. Basically, it's benign and numerous arteries and veins, they have made this in an abnormal way. That's why we call it malformation. Thank you so much for watching. Have a good day.